Hey guys, welcome to Prasu'S Medledge. I hope you all are doing good and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now without wasting any time further, let's get into today's topic. So today I am going to discuss with you Nipah virus disease. Okay, a very important topic. So coming to the introduction, Nipah virus disease is a zoonotic disease which was first recognized in Malaysia and Singapore. So by zoonotic disease, I mean a disease which is transferred from the animals to the human beings. Now coming to the epidemiology, first is the agent. So agent is Nipah virus. It is a highly pathogenic paramyxovirus. Okay, highly pathogenic paramyxovirus. Natural reservoir is the fruit bats of the Pteropus genus, and pig is an amplifying host. Coming to host factors, males and females are affected equally by Nipah virus. Coming to environmental factors, that is seasonality is strongly implicated in Nipah virus outbreaks in India. Then coming to the mode of transmission. So transmission of Nipah virus occurs after direct contact with infected bats or infected pigs, or from Nipah virus infected people, that is by contact with the body fluids of those people, and through drinking of raw date palm sap contaminated with Nipah virus. So these are the modes of transmission. Now coming to the incubation period, it varies from 4 to 21 days. Then period of communicability. So the person may be infective from the day of onset of symptoms till 21 days following that. So this is the period of communicability in case of Nipah virus disease. Now coming to the pathogenesis, Nipah infection primarily involves the blood vessels, okay, in the form of vasculopathy and vasculitis, resulting in perivascular cellular infiltration, inflammation, and necrosis. So the pathological findings which we can see in Nipah virus infection is necrotizing vasculitis, as I have already mentioned, okay, then cerebral edema and pulmonary edema, etc. Now coming to the clinical features, so first is symptoms. So initial symptoms will be non-specific. It includes fever, headache, dizziness, vomiting. Then other symptoms include cough, breathlessness, which rapidly progresses to respiratory failure in case of Nipah virus infection. Along with that, we are having seizures, altered sensorium, and myalgia, that is pain in the muscles. So the hallmark feature of Nipah viral infection is that all these symptoms which I have mentioned you, they will be having an acute onset. Okay, so there will be an acute onset of these symptoms. Now coming to the physical findings which we get in Nipah virus infection, it includes tachycardia, that is increased heart rate, then tachypnea, that is increased respiratory rate, then fall in blood pressure, fall in SpO2, that is oxygen saturation. Along with that, mild hepatomegaly with tenderness may be also noted. Then there can be also signs of cardiac failure. So along with that, multi-organ failure is seen in the severe stages of Nipah virus disease. Now coming to post-Nipah infection complications, that is basically the complications of Nipah virus infection. It includes psychiatric complications and encephalitis, okay, both related to brain only. Okay, now coming to the laboratory diagnosis. So it can be done by IgM antibody against Nipah virus, which is identified in the serum or cerebrospinal fluid, that is CSF. Or we can do Nipah virus RNA identified by RT-PCR, that is real-time polymerase chain reaction. Or we can also do the isolation of Nipah virus. So these two, for these, the samples which we use are respiratory secretions, urine, and CSF, okay, for these two tests. Now coming to the sample collection, how do we collect the sample? So it should be collected as early as possible, that is within 4 days, and with proper biosafety precautions. That is, one who is collecting the sample should wear personal protective equipments and should do proper hand washing before and after the collection of the samples. Okay, this is a very important point. Now coming to the precautions and guidelines to be followed in case of Nipah virus infection. So there should be early implementation of infection control so as to minimize the spread of the virus. Then contact tracing and follow-up of the persons at risk should be done. Suspects and probable cases should be hospitalized in an isolation facility which is equipped with the following equipments, that is portable X-ray machine, ventilators, large oxygen cylinders, and pulse oximeter. Adequate quantities of personal protective equipments, disinfectants, hand sanitizers are to be ensured. Now, one very important point is no accompanying relatives or friends of the patient is allowed in the isolation facility. Very important thing. Okay. Then disposal of the biomedical waste should be done properly. Now coming to the management, first we have to maintain airway, breathing and circulation in these patients. Then we have to start the symptomatic and the supportive treatment immediately in these patients. That is, we have to maintain the electrolyte balance and fluid maintenance has to be done. Parenteral nutrition has to be started if needed. Then paracetamol is given for controlling fever, myalgia, that is muscle pain and headache. And we have to constantly monitor the patient. That is, we have to look for the respiratory rate, level of consciousness and oxygen saturation in the patients. So if the oxygen saturation is less than 90%, then we have to supplement oxygen to the patient. Okay. And in patients with acute respiratory failure, we had to start the patient on mechanical ventilation. That is, the patient will not have any respiratory effort, so we had to start mechanical ventilation in these patients. And then anticonvulsants are given for controlling seizures, that is IV diazepam. Now coming to the specific drug therapy which we are giving in case of Nipah virus infection, that is ribavirin is given to all confirmed cases of Nipah virus infection. So coming to the oral dose, that is for adults and for children it is different. First is loading dose, that is 2000 milligram. Then from day 1 to day 4 we give 1000 milligram 6 hourly, and day 5 to day 10 we give 500 milligram 6 hourly. For children, the loading dose is 30 milligram per kg. Then from day 1 to day 4 we give 15 milligram per kg 6 hourly, and from day 5 to day 10 we give 7.5 milligram per kg 6 hourly. A very easy way to remember this is just we have to half the values. So first is 2000, the next is 1000, then 500. The same goes for children also, that is 30 milligram, then 15 milligram and 7.5 milligram. And you have to remember 6 hourly, 6 hourly. So by this way you can remember the dose easily. And ribavirin can also be given as intravenous administration. That is, it is infused slowly. Now coming to the discharge policy. Nipah confirmed patients should be discharged only after full recovery and when RT-PCR test is negative for them. Okay. Then only we can discharge the Nipah confirmed patients. Now coming to the final topic, that is differential diagnosis for Nipah virus disease. It includes dengue, then cerebral malaria, herpes simplex encephalitis, bacterial meningitis, scrub typhus and etc. And few more are also there, but these are the most important ones which you have to remember. Now let's revise it once again. Nipah virus disease, it is a zoonotic disease. Okay. Agent is Nipah virus. Natural reservoir is fruit bats of Pteropus genus. Then host factors, that is male and females, are affected equally. Then environmental factors include, that is seasonality is seen in case of Nipah virus outbreaks in India. Mode of transmission is by direct contact with infected bats, infected pigs or Nipah virus infected people, that is by contact with the body fluids. Incubation period is 4 to 21 days. Period of communicability I have already mentioned, that is from the day of onset of symptoms till 21 days following that. Pathogenesis is mainly vasculopathy, that is affecting the blood vessels, and we can see pulmonary edema, cerebral edema, necrotizing vasculitis. All these three can be seen as the pathological findings. Then symptoms, initially the symptoms are non-specific and it includes fever, dizziness, vomiting, headache. Later on we can also see the symptoms like cough, breathlessness, seizures, myalgia, altered sensorium, and all these symptoms will be having an acute onset. That is the hallmark feature of Nipah viral infection. Okay, now coming to the physical findings, that is tachycardia, tachypnea, fall in BP, fall in SpO2, then mild hepatomegaly and signs of cardiac failure. Then complications include psychiatric complications and encephalitis. Diagnosis is by either of these. So the first one is IgM antibody against Nipah virus, which is identified in serum and CSF. Then Nipah virus RNA identified by RT-PCR, and isolation of Nipah virus from the following, that is respiratory secretions, urine and cerebrospinal fluid. Sample collection should be done as early as possible. Okay, and we have to take precautions while collecting the sample. Then other precautions include early implementation of the infection control. Then contact tracing should be done, and hospitalization of the patient should be done in isolated facility. Okay, and this isolated facility should have adequate ventilators and large oxygen cylinders, and adequate quantities of PPE kits. No accompanying relative or friends of the patient should be allowed in the isolation facility. Okay, this is a very important point. And disposal of the biomedical waste should be done properly. Coming to the management, first we have to manage airway, breathing and circulation. Then we have to do symptomatic and supportive management, that is fluid maintenance and electrolyte balance should be maintained. Paracetamol is given. Then we have to monitor the patient, regularly monitor for respiratory rate, oxygen saturation. If oxygen saturation falls less than 90%, then we have to supplement oxygen. And in case the patient is having respiratory failure, we have to give mechanical ventilation, and anticonvulsants are given for controlling seizures. Drug therapy is ribavirin. It is given orally. So for adults and for children, the dose I have already mentioned, and you know the method how to remember it. Discharge policy, that is, the patient should be only discharged after the full recovery and RT-PCR test is negative. And DDs include dengue, cerebral malaria, herpes simplex encephalitis, bacterial meningitis, and scrub typhus. So that's it, guys.
So guys, if you like my content, please do like, share, subscribe, comment, and also press the bell icon so that you get notified whenever I upload a new video. Thank you.